really cannot return to play. Now, if you've been around for a while and you've heard Tom debate, you know he just never loses. Regardless of whether the facts are on his side or not, he just never loses because he's so good at debating. So I would ask you to listen very carefully to our arguments and then use common sense. And don't be sweet talked into taking his side just because he's so good at debating. Thank you. These are my disclosures. I must admit that when I was first assigned the debate, my first impulse was to say, yeah, he can return to play as long as the MRI resolves completely and the CT scan shows no other ring defects. After all, he has a synchondrosis, which is pretty strong. It's a failure of ossification. It's not uncommon, and he's played for many years and proven that he can take a hit. But this is why I changed my mind. There's fluid there, and you know that fluid is blood. You don't see it on the other cases that are presented in this session, and he has blood in the synchondrosis. That means that he has injured that synchondrosis. Now, a synchondrosis is made of hyaline cartilage. It's actually quite strong. It's what connects the first rib to the manubrium. But if you damage it, it repairs with fibrous tissue. And it may be stable on flexion extension views, but it is not stable to traumatic forces. Just the way if you dislocate your rib, that first time takes a lot of force. But after that, recurrent rib dislocations are very common because that fibrous tissue isn't strong enough to withstand a traumatic force. Now, what direction led to this injury? Let's think about that. In flexion, the transverse ilianal ligament tightens and pulls the two sides closer together, if anything, narrowing the cleft and jamming the hyaline cartilage, but not pulling it apart. But look what happens in extension. In extension, the dens pushes the two sides apart, tearing the hyaline cartilage and causing the bleeding that you saw. You don't get that in a patient with an intact ring of C1 because that intact ring stops the dens from migrating too far forward. Because he is missing that anterior arch of C1, there's really minimal resistance to posterior dislocation, and he can easily redislocate again. Now, what about the secondary stabilizers, the ligaments? Well, the tectoral membrane is actually taut only in flexion. In extension, it actually buckles. It does not prevent extension because the body says, why do I need a ligament if I have a solid sheet of bone, the anterior arch of C1, to prevent posterior dislocations? And if you actually carefully examine this MRI, it looks to me that there may be an attenuated tectoral membrane. Now, you compare with the normal MRIs in the other couple of cases. I think what you need to do in this case is actually check a flexion extension MRI to look at the integrity of that tectoral membrane. Now, does this happen in real life? Of course it does. Here's a case of a patient who also likely had a synchondrosis. We don't know because we don't have the pre-injury CT scan. But they posteriorly dislocated their C1. And when they relocate it, you can see there isn't much of an anterior arch of C1 the way you would expect it to be. So once you have that kind of an injury, it's easy to posteriorly dislocate. Now, this is a defensive lineman. These guys get hit all the time, and they get subjected to tremendous extension forces on their neck. Now, cervical spine injuries are very common. 10 to 15% of all football players will have some type of a cervical spine injury during their career. It's most commonly seen in linemen and especially in defensive players, so he checks both of those boxes. And 70% of the cervical spine spinal cord injuries were in those who were playing defense. So he checks that third box again. And would you let your son play knowing that he is prone to extension forces and that if he gets hit in just the wrong way, that he will dislocate again through that injured hyaline cartilage? I think not. Can you repair this? Now, a transoral procedure is actually quite easy. I think you could graft this, repair the ring with some mini Herbert screws, and once it fuses and you see on CT scan that that ring has become intact, you could let him return to play. But in summary, at this point, he has an extension injury. It bled. It damaged that hyaline cartilage. There's no test to determine the force necessary to redislocate it, but obviously it's decreased compared to normal. And he's a defensive lineman, which is a position that is very prone to further extension injuries to the neck. So no, common sense tells us, do not let him return to play. Thank you so much for your kind attention.